We are going to be talking about erectile dysfunction today and the impact that your pelvic floor can have when it comes to dealing with and treating erectile dysfunction. A lot of people don't realize that this does not have to be a normal part of aging. They also don't realize that your pelvic floor can be a direct indication as to why you're having erectile dysfunction. Now, previously in a different video, I did talk about how with erectile dysfunction, it can be a warning sign for cardiovascular issues. So if you have not watched that video, I'll link it down into the description so that way you can have access to it. But just to give you a quick summary, if you're experiencing erectile dysfunction, ED, then you want to make sure that you're checking your blood pressure on a regular basis and that you also know your overall cardiovascular health, because a lot of men will begin to experience symptoms of erectile dysfunction before they start showing any cardiovascular issues, but it is a direct indication as to how the blood is circulating throughout your body. So let's jump in first to talking about what erectile dysfunction is, and then the impact that your pelvic floor and other surrounding structures can have when managing and treating erectile dysfunction. With erectile dysfunction, this is when a man is unable to obtain or maintain an erection. There are times when a man can obtain an erection but is not able to maintain that, and that also can be an issue with blood flow, but also with other issues involving some of those pelvic floor muscles. So just because you can obtain an erection does not mean that you don't have ED. There are times where men who can obtain this but still cannot maintain it. So take that into consideration when you are looking to better address your symptoms of ED. So when it comes to obtaining an erection, we already know that this is important when it comes to certain tasks related to intimacy. Men want to be able to obtain an erection, maintain an erection for the duration of the time in which desired. Yes, there are medications that can help with this, but there are other root causes that need to be addressed. I've already mentioned blood pressure and your cardiovascular health. So don't just quickly pop the blue pill, but let's take a look at some other things that can impact. Being the pelvic floor, that is one major factor. But before we jump in a little bit more to the pelvic floor, I at least do want to take a moment to address that I'm not going to be going over information as far as treating erectile dysfunction related to surgical interventions, such as when men have the prostate removed. With surgical interventions, that can pose some other concerns and issues with some of the nerves and neural components in the area that may have been impacted from the surgery. Right now, we're speaking solely about men who have experienced erectile dysfunction without the presence of surgical-based interventions, okay? So this is just because of lifestyle, because of stress factors, those different things, or even because of your tight pelvic floor. So it's not uncommon for me to see a man for erectile dysfunction and for him to tell me, my provider told me to do more Kegels. Well, one, the provider telling them that is not all that helpful, because a lot of people don't even know how to do a Kegel properly. So when you're teaching someone how to do a Kegel, you want to make sure that you're giving them the proper instructions, because teaching a Kegel and activating the appropriate muscles will be important as to how effective it is. So for my men, I'll typically tell them, I want you to try to shorten your penis. I want you to try to also lift your sac without using your hands, or even the cute, I want you to pretend that you're holding gas in. Now, with the first two cues I gave, with the sac lift and shorten your penis, those two cues are more so going to strengthen the anterior or the front part of the pelvic floor. The holding in gas cue, you'll probably feel more just the muscles around the anus contract and close off, which is going to strengthen the back side of the pelvic floor. Having a strong pelvic floor means you want for both sections of this area to be strong. But in the beginning, a lot of times I'll focus more so on shortening the penis or trying to lift the sac itself. So that way they're able to work on getting the muscles that are stronger, directly associated with changing the length of the penis. Now that you know how to do a Kegel properly, we have to talk about, is it really the best option? And for some men, the answer is not immediately. So you simply doing more and more Kegels is not going to help with you preventing or decreasing the chances of erectile dysfunction, or if you're in the midst of ED, it's not going to necessarily improve it if you have tightness within these muscles. Because if you've ever tried to strengthen a muscle that's already tight, you're not going to get the full range that is needed. So for men who have overactivity or increased tightness in some of the pelvic floor muscles, including some of the hips, some of the hip muscles, then you really want to make sure that you're taking time to lengthen those muscles first. And if you don't have good flexibility in your back, in your hips, in the growing muscles, then that can impact how your pelvic floor is contracting as well. And you may have increased tightness in the pelvic floor muscles. So a big portion of treating erectile dysfunction is seeing how well someone can relax and lengthen these muscles, and also assessing the lumbar mobility, so the movement in the lower back, and also mobility in the hips. So if you're not already stretching, this is your cue to start stretching. Unfortunately, as we get older, we know that we stop moving as much. And when men hit around the age of 50, this is when erectile dysfunction, the chances of developing it, increase significantly. And what else happens around this time? Decreased activity. So make sure that you're staying active. Make sure that you are moving. Make sure that you're stretching, so that way you can keep your mobility and decrease the chance and risk of erectile dysfunction. Now, with that being said, you already heard me mention that you need to lengthen your pelvic floor muscles. Something that you can do that's pretty easy every single day is learn how to properly breathe. If you're someone who's a shallow breather who pretty much uses their shoulders and their neck muscles to lift their ribs, I'll show you first. If you're someone who's breathing that way, then you're not going to get the full use of your diaphragm, and you're also not going to get the full lengthening of your pelvic floor muscles. So you really want to make sure that you're taking in those deep belly breaths, but not just the belly moving, but you're actually getting your ribs to move, your lower back to move, and you can feel your pelvic floor move. So right now, I want you to go ahead and take your hands. If you're sitting down, I want you to place your hands underneath your bottom, so directly underneath your sit bones. With your hands there, I want you to take a deep breath in, so breathing all the way down into your hands, so that way the belly moves out, and you should actually feel the muscles that you're sitting on. You should feel those muscles drop down into your hand. So go ahead and take a deep breath in, breathing in through the tummy. Don't use your shoulders. And now exhale. So each time you take a breath in, the pelvic floor is going to lengthen. If you're sitting, you should feel the pelvic floor muscles drop down into your hand. And naturally, as you exhale, you may feel those muscles lift up just a little bit. Breathing is a wonderful way to help relax these muscles, decrease the tension, and also work on getting these muscles elongated or longer, so that way you can have improved mobility here. So when it comes to your pelvic floor health, the pelvic floor health is very important. You already heard me mention, yes, you need to work on strengthening, but sometimes not immediately. And yes, you also want to work on strengthening of some of the surrounding muscles. So looking at your core strength, looking at your glute strength, your hip strength. That way you have an idea as to how all those muscles are working together. Now, if you're noticing that you're having symptoms with your erectile dysfunction, such as pain, then I really want you to focus more so on the lengthening portion and relaxing those muscles, because at times pain can be linked to having increased muscle tension. Now, another key factor when it comes to understanding the importance of our hip mobility that we mentioned before is that you want to make sure that you're doing hip mobility that will, yes, keep you moving, but also not cause or contribute pain. I know that some people will say, well, no pain, no gain, and that's not completely true, especially in this case. So if you're doing movements and activities in hopes of improving your pelvic floor, in hopes of improving and decreasing ED symptoms, you want to make sure that they're not painful. So some stretches that you can do that should not elicit pain are things such as stretching your hamstrings. You can do lumbar flexion stretches where you are trying to see how much you're able to actually bend your back. You can go into doing cat-cow, so that way you're able to get more rotation and movement within the spine, get more flexion and extension in those motions. You can also focus on doing pelvic tilts, which, yes, will help strengthen your deeper core, which works along with your pelvic floor, but also will work on mobility at the hips. Don't shy away from stretching your piriformis muscles, so muscles that are on the outside of the hips that at times have become really tight. You'll see people when they try to put their shoes on and they're sitting down, if they can't get their foot up on top of the other leg, they may have really tight glutes and external rotators at the hips, so especially those piriformis muscles. So making sure you're taking the time to work on mobility. Now, if you're someone who can't touch their toes, that lets you know where you should start. If you can't bring up one foot to sit it on the other side, that also lets you know where you should start. Because erectile dysfunction, the pelvic floor itself is very important. So you want to make sure that you have mobility and that you have the strength. So now I've kind of harped on mobility and strength. There's another reason why the pelvic floor is important. In the very beginning, you heard me mention that blood flow is essential for erectile dysfunction. So that's why knowing your blood pressure, knowing your cardiovascular health is important. But if you have a lot of tension in your pelvic floor, if you have decreased mobility in the pelvic floor, guess what you also may be limiting? In some cases, you can also be limiting the amount of blood flow that is in this area. So tight muscles will impact blood flow. Also, muscles that are properly functioning, so where you're able to get muscles that are lengthening and shortening as they should, those can act as a pump to try to help move blood in and blood out, lymphatics in and lymphatics out. So that way now you're able to achieve an erection, and it also not last longer than what it's supposed to, because that can also be problematic. So pelvic floor is important, not just strength-wise, not just mobility-wise, but also because it can help promote circulation. So you want to make sure that you have good circulation. You want to make sure that you have mobility so that way you can achieve it. So if you're someone who's dealing with erectile dysfunction and you have not taken the time to address the pelvic floor component, I encourage you to make sure that you know where your strength is. If you cannot actually feel yourself trying to lift the sack and things just feel tight, you may want to focus on lengthening first. Now, if you're someone who doesn't feel any movement at all because you're just so weak, like even if you can't hold in gas, then strengthening may be important for you to focus on first. But if you're someone who knows you can't touch your toes, you can't bring your foot on top of the other side, then you may want to begin mobility and stretching. All of these things are going to be important. So you're never just going to stay in one category. You may need to address certain things in each category. In addition to addressing these things in the categories, it's important that you stay active overall. With your everyday activities that you're doing, each time you're moving, you're walking, whatever you may be doing, your pelvic floor is engaging with you. So make sure you're giving it the opportunity to be able to fully engage as you're doing these activities. So if you're not walking already, I want you to consider some type of cardiovascular-based exercise training, such as walking. If you're a runner, then yes, continue running. But even then, making sure that you are aware as to what your overall health is like. So movement is going to be key. Pelvic floor strength and mobility, that's going to be key. Your blood flow is going to be key. And there's something else that we have to address when it comes to understanding the pelvic floor, and that's stress. When it comes to stress and also different emotional-based triggers, then that can impact how the pelvic floor responds, and it also can impact whether or not someone's able to achieve or maintain an erection. At times, when times are very stressful, one of the last things your body is going to do is be able to support an erection. So it's important that if you have high stress levels, that you do what you can to manage your stress. And not just for the cognitive or psychological portion, but also for the physical component, because stress is going to increase your blood pressure. We've already mentioned the importance of cardiovascular health with managing ED, but stress is also going to increase the tension that you have in the pelvic floor. So it's extremely important that you take time to address these various lifestyle factors that contribute to stress. Make sure you're getting a good diet. Make sure you're drinking plenty of water and sleeping. And let's be honest, we cannot escape stress out of our everyday lives, but we can learn better coping techniques. So even working with a mental health specialist can be really important for some men as they're looking to better manage stress so that way they can help combat ED. Well, I hope this information was really helpful. I would love to answer any questions that may pop up. So if you have any questions on the topic of ED and how the pelvic floor mobility, as far as you being able to lengthen and relax those muscles and contract those muscles, are important, let me know. If you have questions as to how the pelvic floor relates to and responds to stress and also cardiovascular health, especially your blood pressure, that's the easy one to check at home. Please let me know in the comments and I'll be happy to answer those.